hosting. Dr. Vikram, I would request you to please give us a orientation of few minutes so that we can have
Yeah,
a
sure.
better understanding of the medicine, also the kind of the way this disease is classified, mild, moderate, and then severe. So according to which, how you decide the medicines and go for the treatment. Let us know about your COVID center. First of all, let me congratulate for zero mortality, running a COVID center with a zero mortality, and we would be expecting government of India to come up with some kind of recognition and reward for Siddha medicine and to you also at the national level. Anyway, you are already known to us across India.
Thank
Please
you.
welcome.
Thank you.
We welcome you, sir. We welcome. Yeah. So, for the audience
Hello, sir.
purpose, I have some information that I would like. I'm very happy to share with the audience that state government of Tamil Nadu has done a wonderful job. They decided to run 29 COVID centers, and all these 29 COVID centers, uh, Siddha medicine, the treatment using Siddha medicine was prevailing, and over 4,200 beds. That was the occupancy created by this initiative of the uh, state government of Tamil Nadu. And Dr. Vikram Kumar and other doctors like him has done a wonderful job. Almost, he would tell us the success story. Dr. Vikram Kumar. Thank you, sir.
Sure. Thank you, sir. Very pleased to be invited in this session. I would like to thank Professor Lalit Mishra sir and the group of the foundation. And very happy to see my lecturer, Dr. Aravind sir, taking a lecture again. It was something like a nostalgia before 10 years or so. So I would like to share about the experience in my Siddha COVID care center for the past 1.5 years. Actually, in the first COVID wave, we treated around 625 patients. Now, in this second wave, we had 4 centers. Last year, we had only 1 center. Now, with the help of district collector, the center was expanded in 4 areas. So this year it's about to get finished. So 1,400 patients are treated with Siddha system of medicine. So totally 2,000 patients are treated with Siddha system of medicine, including the first wave and second wave. So I would like to share the experience. Sir, next. Okay, let's take this session as a traditional gruel, that is, you can say it as kanji. It consists of lots of mixtures. Similarly, in this session, we are going to see about the research work and my experience and all the incorporates into the in the COVID care center. The next. Okay, let's assume this as a visual tour because whenever I go into the Siddha ward, usually I wear the protective equipment, that is PPE. But since it is a webinar, I will get you into the center without wearing a PPE, so it will be a very good experience. The next, the next. So this is a respectful collector of the Tirupattur district. Actually, he was transferred to Chennai just a few years before. He was the main backstream behind the success of Siddha system of medicine in Tirupattur district. Was very, very helpful in reaching, taking Siddha to the next level. Right from the start of March, he was very helpful. The next, the next.
This
Okay,
is the
this
COVID
is
center,
the,
your COVID center.
yeah. Yeah, so this is the COVID center, one of the COVID center. Actually, we had 4. This is the one COVID center entrance. So we had depicted what's in store for the patient. Whenever the patient arrives, he will read all the things which he is going to get inside the campus. The next. So these are the things which are depicted in the front of the center. We used to give herbal soups both morning and evening time. So what are the preparations, the ingredients, how to prepare, all the details are shown in that flex material. And also we will be expressing our traditional ways of things to patients. If a patient comes, when he goes outside, he should also get rid of COVID, also learn Siddha system of medicine and the things which are in Siddha. So we have just a small exhibition like that in all the areas inside the center. For example, we insist them to use mud pots for cooking, for even for drinking water, like pots, etc., and the herbal mixtures into the water, something like that. We will be insisting them to get back to our tradition. The next, the next, the next. Oh, these are the rooms. We could see around 50 IEC materials depicting how to live a healthy life. What are the food styles? What are the lifestyle activities to be followed from morning to evening? COVID patients used to read these things, and they used to ask me during when I get into the COVID care center wearing PPE. So we incorporate all the Siddha system of things into the patients. When he comes outside, he will be getting all the details regarding the good healthy lifestyle and the food style to be followed after post-COVID, and to avoid post-COVID complications, something like that. And also we have named each rooms based on our Siddhas, that is 18 Siddhas, and also our Tamil literatures. For example, Agathiyar Arai, Tirumular Arai. Similarly, literature names also named for the rooms inside the center. The next. So these are the rooms. So every room will have two occupancies along with a study table. So patient will feel a lively atmosphere. They should be, our main motto was to make the patients feel at home. It should not look like a hospital. There should be no hospital atmosphere, something like that. We had even had a library inside it. I will come to it. We will be also having that gap between patients. So social distancing was maintained inside the premise. Next. So this is the veranda of the Siddha COVID Care Center. As I said already, 50 boards plus a small 50 pamphlets were also placed inside the campus. So every patient get roaming around the campus in the morning time and evening time. They will get to knowing about all the details. As Dr. Arvind had said, Siddha principle, the hypothesis, everything will also be presented inside those IEC materials. The next. So you could see a mud pot with a tulsi herb there. So every patient will have a small pot when they go inside the campus. So if they are there inside for 7 days, for example, inside the campus, they will be nurturing that herb. So that will itself give a sense of pleasure. Something is getting helpful by them. So every room in front of the every room we had this pot. So patient used to garden these herbs, which gave a sense of satisfaction to the patient. The next. So every evening we had the awareness speech, as I already said, about mainly about the system of medicine, the practices which are being followed in our country, and also regarding food style, lifestyle, and also doubts are cleared which were asked by the patients, because most of the COVID patients are in a state of panic. So whenever a doctor gets inside the COVID care center, and if you just talk to the patient, everything the patient feels okay. So for that, every day I went into the Siddha COVID care center to deal with the patients, to deal with the doubts, to make them pacify. So it was a great success in regard of pacifying the patient's state of mind and the panicness which was set up inside their mind. The next. So this is the library which was set up inside the center. It was called as a COVID library. We gave all types of book, because even children books, because children were also admitted inside the campus. So we had books related to herbs, books related to Siddha, medicine related books, and also comical books. So all the books were kept inside the library. Our aim was to make patients avoid cell phone usage, and also television usage, because whenever they read books, their mind gets clarified, they get relaxed. So it was a huge success in the COVID care center. Every patient, when they go out and they get discharged, they tell about this library was very, very useful. So by saying this, lots of center also started this library concept. It was very, very beneficial to the patient. The next. The next. Next. So this is the eight-shaped Siddha Varma pathway. We call it as eight-shaped walk. So a patient used to have a walk in the eight-shaped pathway both morning and during night time. It's like a mild physical activity for patients because just to get rid of the COVID intensity, we used to ask the patient to walk in the eight-shaped pathway. So it itself relaxes the mind. Lots of small studies say that it actually pacifies the mind of the patients. The next. The next. So this is the concept which was also a huge success, that is dining with the moon. I call it as Nela Choru in Tamil. Uh, just because we have just left out our tradition, because during the night time we people used to sit in your home top or outside the home. There was a society which used to eat in a group before 20 years or so. But nowadays, this concept is not in use. So just to get back this tradition into people, we use this dine with moon concept. So COVID patients used to have a dinner in the with social distancing, which made them feel at home, and also just that gave a pleasure to the patients. It was also a wonderful success. Patients used to talk about this also when they get discharged. Next. So this is the herbal garden. Actually, it is a grown spot. We had around 50 herbs inside that COVID care center. People used to do gardening, and the names and the uses of the herbs were placed in boards inside the campus. So they get to know about the herbs which are used as medicines in Siddha, and also to use in home itself. So lots of small herbs which can be used in home herbal garden were depicted. So people used to enjoy this gardening inside the COVID care center. Similarly, we had Karpuravalli, that is Anisocollus carnosus, which they can use it for steam inhalation. Similarly, Vitex Negando Nochi. So they can pick their own herbs inside the campus itself and use it for treatment. If they have anosmia, that is, if they couldn't have smelling sense, they can just take the Karpuravalli leaf and they can sense it. So similarly, lots of mild small innovations were in that herbal garden. The next. So this is a small swing which is placed inside the garden. So we call it as a neem swing. That is, it is placed between two neem trees. This neem swing was used to avoid mood swing in COVID patients, because whenever, apart from age group, regarding age group, everyone used to enjoy swing, isn't it? Right from the childhood up to senior age, everyone enjoy the swing. So it was placed in between two neem trees. So people just take a book or take their phones and just sit in the swing, and they get relaxed. So the mildly swing, which brings a sense of a good feeling among themselves. It may sometimes secrete endorphins too, isn't it? So whatever things which make the patients happy, we use those techniques to pacify them. Next. So a television set was kept inside the COVID care center, a 50-inch television set. So we could see a small child watching Cartoon Networks. Similarly, old age people were watching serials. Similarly, cricket, while during the IPL season, people were watching cricket. So our main aim was to get patients away from COVID. So this television set also proved very, very beneficial. People used to watch TV with proper social distancing, which was very helpful at that time. The next. So every day, Siddhar Yogam and Tirumular Pranayama techniques were taught to patients. So this also brought a good a sense of feeling among patients. They learned about yoga techniques in Siddha system of medicine. They learned about the Muchu Pech, that is breathing exercises in Siddha system of medicine. So the breathing exercises and the yoga are not only for treating these communicable diseases, but also when they get away from COVID to treat their non-communicable diseases, this yoga and pranayama will be very, very beneficial to them. So we advise to follow this yoga techniques even after they get rid of COVID, to be followed throughout their lifetime. So every evening before the awareness speech is given, we used to teach yoga. So people used to do with good thinking, and also they used to do in the morning session. Also, we monitored that. So everybody did their part well. The next. And this is the pranayama technique, and this is the breathing technique which was given for patients. Everybody know the breathing exercises are very, very beneficial for the COVID lung. It improves the lung capacity, which was proved many times before, even before COVID itself. So for giving breathing exercise to COVID patients was very, very beneficial. They felt their breathing good, their lung capacity has improved. We have documented few things regarding this also. The next. So this is a new innovation, that is herbal mask. A young doctor named Bhaskar has innovated this herbal mask. It consists of different proportions of volatile oils taken from natural herbs. So it will be applied in the normal mask, and patient used to wear those masks. They could feel the smell of the pleasure of the herbs, which was very, very beneficial for COVID patients if they had mild symptoms like cough or cold or nasal stuffiness. They could feel the sweating from their head or so. So it was very, very beneficial to the COVID patients. Next. So this is the steam inhalation procedure which was followed inside the campus. We gave a separate individual part to each patient when they get inside. We also give hot water in the evening time along with herbs like Vitex Negudo and Anisopilus connosus. So people used to steam inhalate daily, which was very, very beneficial. Now there is a propaganda going that steam inhalation is not good, but the actual thing is, if we do in these kind of parts, steam inhalation is very, very good, because we are getting a mild vapor coming from the parts. So it was very, very beneficial in Siddha system of medicine. Steam inhalation is an excellent procedure to treat kappa-related diseases. So steam inhalation proved very good for patients inside the COVID ward. The next. The next. So these are the herbs which are even eucalyptus leaves are also added. Similarly, Vitex Negudo and the even neem leaves were also added in the first steam inhalation. Next is the fumigation purpose. This is outside the campus, the COVID care center. We used to fumigate with around 24 herbs, dried herbs. So that it's just a hypothesis. It may cleanse the atmosphere. We don't know whether COVID is even spreading through air. Still no. It is a it's something like that. So we use this technique. It might have been helpful. Similarly, this fumigation was done inside each and every room of the COVID patients. So the smell which is coming out there, and the vapor which is sorry, and the fog which is coming out of that part is very, very pleasant. So it made patients feel happy, felt happy. So next. This is the external surrounding of the parts which is placed inside outside the campus. The next. So this is for COVID patients inside the campus. We used to fumigate daily, wearing PPE. The next. The next. So apart from fumigating, in the evening time, we had a traditional lamp which consists of Maduka longifolia oil. Actually, this oil was used in temples in older traditions, but nowadays it is not used. It says that it gives less smoke when it is burnt. So it just insisting these traditional methods to be followed in their homes in the future. So it was a good thing too. The next. Next. The next. So this is the traditional kitchen setup, which was made just in front of the COVID ward. So everything was traditional, because the soups which we are preparing also from earthen pots only. So it was prepared with fresh leaves, with raw drugs which are used in Siddha system of medicine, and it will be served hot directly from the traditional kitchen, just opposite to the Siddha COVID care center, which the patient felt very good. Around four varieties of soups and herbal preparations are given daily to COVID patients. For example, Mudakaratan is a wonderful herb. Similarly, Tudvalai soup and sprouts, which are rich in proteins, were given to patients. So patient felt very satisfied with these herbal preparations, which are seen direct by them. The next. So these are the materials which are used for the soup preparations. So you see Ada Doda Vasica leaves, similarly soup, pepper and tipili, everything which was used here. Similarly, betel leaf. That's the few things, but we used around 25 herbs to treat COVID care patients. The next. So this is the preparing picture of the herbal preparation. The next. So these are our volunteers who are just giving those herbal soups to the patients. The next. So these are the thing which was used, and that is Kabasura Kudini and Nilavembu Kunir in during evening time. Similarly, Ada Dodai soup, Adimaduram soup, which is a sweet soup, which is very helpful to treat COVID care patients. Next is the traditional gruels. Different kinds of gruels were given on daily basis. Similarly, herbal snacks like the herbal biscuits were given, millet-based snacks, sprouts were given on a daily basis. So we made them eat healthy and also snack nature related things. So it also proved very beneficial. If a patient comes with symptoms, you used to get rid of the symptoms very soon compared to other COVID care centers. It may be due to, along with medicines, it may be due to these kind of herbal soups and the traditional gruels and the herbal snacks. The next. Sir, next. So regarding Siddha medicines, it was since it was a question asked in the last session, we used Amukra Churnam tablet, Talisadi Vadagam another chewable tablet, and Adadodai Manapagu the syrup, Adadodai syrup type of thing, and Brahmanandam Bhairavam tablet and Kabasura Kudini. These five medicines were used in the Siddha COVID care centers for 2,000 patients. These are the main basic medicines. Apart from this, symptomatically, we also treated many Siddha medicines to the patients. So these five medicines were, we carried out a small pilot study also, clinical trial with getting approved from CTRI. So for 20 patients, we used these medicines and documented. Also, we have documented for 2,000 patients, but for this study, we used 20 members. Blood parameters was checked before and after taking medicine. There was drastic reduction in LDH level, lactate dehydrogenase enzyme, which is a major factor, which is an increasing factor in COVID patients. After 5 days of medicines, LDH was decreased. IL-6, which is responsible for cytokine storm, which is a huge topic during the last wave, it also reduced. IL-6 platelet counts increased. So lots of things which came out, and the paper is about to be ready. It will be soon published in a journal. Similarly, lots of paper works are coming in uh, different districts. So Siddha papers will be soon be documented in all papers. The next. So this is the monitoring of vitals. So as professor has said, this is a mild dance. Always it's a boon to a heavy mind. Because people, whenever they enter the COVID care center, they feel so much of panic and anxiety gets sets in. So during night time, I used to dance wearing the protective equipment. When a patient is about to get discharged, even they also dance if they feel fresh and energetic, and their vitals, that is, oxygen saturation is normal, their BP is normal, everything is fine. Means they also get to dance, and they feel satisfied after I dance. From next day itself, we could see patients feeling at home, feeling a homely atmosphere. They feel that the doctor is for them, because our main aim during the last time, the our district collector insisted, the thing is, the people, we should not see COVID patients as untouchables. We should see people with humanity. That is the main thing which COVID patients were lacking. Also, my idea is the protective equipment kit and the mask are just a barrier to the virus, but not a barrier to patients which are in front of us. So, taking humanity into account, I used to dance mostly on a daily basis. to make feel comfortable. Even patient used to sing, they used to, as I said already, they used to dance and they get relaxed. I have to tell another thing in this slide. A patient who had around saturation level around 93 before this session. After the session ends, we used to monitor the oxygen saturation. The patient who had 93 oxygen level went to 98. It was a pleasant surprise because everyone know dancing used to secrete endorphins, which is a happy hormone inside our human thing. So these things may in future may be used to treat COVID patients if they are mild, moderate, and they are feeling physically fit. So it was very nice and a different experience to me in the last wave. The next, the next. So we just give a podium for patients when they get discharged. That is like a small stage. They used to express their feelings, what they felt while they were inside the Siddha COVID Care Center. Like they used to tell about the dining concept. Yeah, this is the stage which we used when patient get discharged. We used to clap for the patients who are getting discharged. They will express their feelings. That is, dining with moon concept was good, library was good, dancing concepts was good. And it just we gave what to say a honorable cushion to patients who are getting discharged. And so this is the research thing, the blood samples, just a photo, which I said already. Everything is documented. So similarly, from this next month onwards, many papers may come regarding the research work. The next. So these are the results which I had already expressed. Actually, for the last in the during the last wave, 625 patients. In 625 patients, the next repeat swab was done on the sixth day. So with just 5 days of Siddha medicines, the five medicines I said, repeat swab was done for around 625 patients. So everybody become negative in the sixth day. Only around 20 or so become repeat positive. They also tested negative after a few days of the repeat test. That is the third swab. So 625 patients were repeated with the swab and they turned negative on discharge. Similarly, this year also around 1,400 in all the four COVID care centers got discharged. So totally 2,000 patients. So this is about only one center. We had four centers with similar setup, even in natural setups also, where patient enjoyed apart from taking treatment. They used to say they have come for an excursion or something like that. They felt very happy regarding the atmosphere. Next. So regarding the post-COVID visit, patient used to call if they have any doubts or if they have any symptoms in the future, because post-COVID complications are very important topic. So we had our telephone numbers, doctors' numbers. So telephone conversations are still going on, especially during the second wave, because it is very severe compared to first wave. Actually, in first wave we had mild and asymptomatic patients, but in the second wave we had a lot of mild, moderate, and every patient had symptoms. Whenever they entered, there was very rare that patients are asymptomatic. So we used to give lots of medicine, those soup kind of things, the nature kind of things, which built a sense of satisfaction and symptomatic relief to the patient. So as a doctor, it was a very sensitive thing for the last 1.5 years, something like that, because I used to be a part of their illness. I could make them happy, which give as a doctor, which give a great amount of satisfaction as a doctor to me. The next, the next. So it was a great team effect in the end, because to coordinate four centers with the help of, we had even volunteers from lots of districts in Tamil Nadu. With the success of our Siddha system of medicine and the center in the first wave, lot of student volunteers came for the support to maintain four centers. It was a great dream come come true, I can say. I also thank my district, the medical officer, Dr. Susi Kannamma, madam. So was so encouraging to me for the past 1.5 years. The next. So again, I would thank my district collector, because he had done lots and lots of things for the Siddha system of medicine. Actually, during last year March, before the government said Kabasura Kudineer will be helpful in COVID, he insisted us to give Kabasura Kudineer to Tirupattur district, which we did, and there was no cases for the next 2 months. Only after April and May, June only we started to get COVID patients. So Kabasura Kudineer was very, very helpful, and also we did a small study during that time also. With the help of that paper, lots of next steps were taken by the government for all those causes, good causes. The respected district collector was the main motto and very, very encouraging behind our success. The next. So I have to say it's time for Siddha medicine in the next era. Apart from Siddha medicine, we also can take, we have an integrated approach in the future to treat all kinds of diseases to make the society healthy. That's the aim of our system of medicine and also our thinking. Thank you so much for your patient listening, sir. And once again, I would thank Professor Lalit, sir, and the Indology Foundation, and everyone who had patiently listened to this session. Thank you, sir.
Yeah. Thank you, Dr. Vikram. We have learned again a lot. I noted certain points from your presentation, like dining with moon, social distancing, library, uh, dancing, and relaxing. So many things. First time which we are missing in all the North Indian COVID centers, I would say. I have visited some Ayurvedic COVID centers also. Although in Delhi we have All India Ayurvedic institution. They also
Oh,
have no death recorded for around 231 or 240 patients. Out of those many patients, no death recorded. But this kind
oh,
of this kind of setup, fabulous setup, which has not only cured them but also healed them mentally, psychologically, in so many ways. It was not seen here. Rather, it was missing in the planning itself. So I have to congratulate you. I have certain queries.
thank you.
Like this Kabasur Kudir, how old, how ancient is this medicine? Is it this not the medicine but formulation? Is it recently prepared in order to tackle the viral diseases during dengue or chikungunya or so, or it is an ancient one? So how you people find that this particular formulation is going to help the patients overcoming the infection, COVID-19 infection?
Yes, sir. Actually, Kabasura Kunnir is mentioned in ancient Siddha text. So taking COVID as a kapha-related disorder, because the symptoms which are mentioned during the first wave were mostly due to like kapha-like symptoms, that is cough, sore throat, or anosmia, or headache, or body ache, which we take it as kapha-related disorder. So Kapha Kudini, which is used for kapha treatment in Siddha system already. So taking
Okay.
that symptomatically into account, we administered Kapha Kudini for this kapha-related COVID thing, but also the 15 herbs which are present in the Kapazarocodinir where they had antiviral activity too. So we
Mm.
can't say directly we can reduce the COVID virus, but it proved very, very beneficial in COVID patients. So if a large study or a pharmacological study, if it is done in future, we can prove that Kapasarocodinir kills the COVID virus also. So we're waiting for a large publication or sorry, large research. Sorry, 1 minute.
Mm-hmm. What happened?
So 1 minute.
Okay, good.
Sorry, sir.
Yeah. Yeah. So yes, there are certain good things, new things like steam inhalation, the way you have demonstrated, dining with moon, fumigation with neem. So yes, we would like to know the selection procedure of the 24 herbs and the herbal preparation that was done locally. In fact, you have not gone for the industry or the synthesized
Yes,
compounds. Rather, you prepared these these ingredients or the medicines locally at the hospital or the campus, COVID campus only. That was really very great.
thank you.
Uh, I heard in the I heard that you also came up with a questionnaire. There is an ancient scripture which has got a laundry list of the questionnaires. Out of that larger set, you selected the most relevant set of the questions, and then those questions were helped screening of the patient. So
Yes.
yeah, how did you do this? I was very interested to ask. I thought I will ask in the beginning, but anyway, please let us know, sir. Yeah.
We had a few inclusion criteria and exclusion criteria. The first thing, we asked the patient whether you like Siddha medicines. Are you willing to take Siddha medicine? Because we are just having a small study with you. So only if they accept to that thing, we take them. We took them to study. Actually, everyone accepted to enter themselves into research, because before we started research, Siddha Center was familiar in media, so everybody wanted to be a part of Siddha success. So we gave a
Oh,
questionnaire regarding their health, their body constitution, because we have a Siddha questionnaire itself regarding their health, their body status, their mind status, the psychological impact, how they think about things. So these things we segregate as Vada, Pitta, Kapha from the questionnaire itself. So we
mhm.
just made a small study. It was very productive in that thing.
Okay, okay, okay. So, for my own interest, I am asking this audience. It's not a question of the audience. Like from these three dosa, Vata, Pitta, and Kapha. So, how will you classify this particular disease, the COVID-19, whether it relates to Vata or Pitta or Kapha, or it begins with a Pitta and then progresses to a Kapha, or what? What is your observation?
Yeah, I can say, especially in the second wave, we can see kapha predominate symptoms along we can say as kapha pitta related disorder, because everybody had whenever the lungs get into the phlegm gets accumulated in the lung, we can say it as a kapha. Similarly, they had the cough, the productive cough, sometimes the dry cough, the headache, the heaviness in the head. So, from my observation, and also many people in the Siddha fraternity and even higher officials are taking this as a kapha pitta related disorder, kapha related disease.
Okay, so after admission of a patient, how many days after the admission you generally observe the improvement, like 3 days or 5 days or maybe um, more days? Can you please let
Yeah,
us know?
yeah. Psychologically, they get relieved in the next day itself, because first day itself we give those things like this dancing, the even singing under the musical chair like things, and
Mm-hmm.
interacting with patients. So psychologically, their anxiety gets reduced the next day. So second day. So from third day onwards, we could say symptomatic relief in patients. So if they have
Okay.
cough or mild cough, the headache, when they get steam inhalated, the headache gets to reduce, the heaviness of the get reduced. If they have sore throat, we have a Talisadi Vadakam chewable tablet. You can just chew it, you can feel the difference. Similarly, the herbal mask, as I said in the slide, which was also very, very beneficial. Like, immediately, could see sweating coming out of our head. Even for
Mm.
anosmia, we used to give those herbal masks. So from third day onwards, we could see patients improving day by day.
Okay, okay. So great. So anyway, have you also observed, at least, a small section of the patient, like situation getting aggravated, worsening, and then you had to do something in terms of the treatment to bring them back or control their situation and bring them back to the normal situation. So how many cases, or what did you do actually? Because you used five medicines, as you said. So, in what condition these five medicines were used, other than these Kabasur Kudine, four others?
Yeah, for everyone, we gave this basic medicine, as as you already said. Few patients were also referred. For them, aged people, their saturation dropped. Similarly, for example, especially in this second wave, we could see patients' oxygen saturation level dropping suddenly. When we see in the morning, they had above 93 or so. But when we see their saturation level during evening or night time, we could see 85. So it was a major thing which we observed in the second wave. It was not much heavy in the first wave. So if their saturation drops below 85 or so, we used to refer. We have one oxygen setup here. So we try to give and also give our medicine. But if it doesn't get increased, we used to refer to higher centers. In the sense, it is a COVID care center. We had only one oxygen capacity. So if they are in need, we
Mhm.
used to refer. But we gave medicines for a lot of the patients who were above 85. We gave CROMB related medicine. Similarly, higher order medicines, as Dr. Aravind has said, perform chendurams were also given, which proved very, very beneficial most of the patients. But if their oxygen level is not improving, taking patients' life into account, we used to refer to higher centers, that is GH around Tirupati district.
Okay, okay. So, as you said that a research paper is likely to come. So, what is going to be the sample size of how many patients, maybe 1,000 patients that you have cured, and other centers also. So, what could be the approximate size of the sample of how many patients this study is going to be published? And we would like to have a copy of it when it is published.
Sure,
Yeah.
sir. Actually, blood test was taken for only 20 samples, but we treated with repeat swab for around 2,000 patients. But blood samples with the CTRA registration study was done for 20 samples only. So it is a small sample size, but if it takes this study as a basic paper in future, it will be beneficial. But apart from blood picture, a study paper will also come, including all the patients, how the psychologically they were before and after, how the repeat swab became negative. But with the CTRA registration, we did with 20 samples only.
20. Okay, okay. One last question from my side. I noted that for those patients whose oxygen saturation level was down, so have you definitely would have given them some medicines, the herbal medicines or the Siddha
Yeah,
medicines. So can you please let us know what was the most effective herbal medicine in case when the oxygen saturation was going down?
yeah. As I said, that cramp related medicine, we had even the adadodi was. We actually have a powder and also a soup which consists of adadoda vesica, that is adadodi,
Did
cramp
you
with
use
the.
Ayush 64 Kala or you had your own
Yeah, one
Kala?
preparation means it is used in Tamil Nadu, which we
Hmm.
used in the first wave also, Aradure, also Adimadura herb, which is very good for improving the lung function. Similarly, we used betel leaf. And also we had Vasanta Kusmagram, a tablet, which also beneficial. We just keep inside a betel leaf and use ask to chew the medicine. So these things gradually improved. If they are above 85, 86, they used to come. Also, we gave some Tipili Rasayanam, which is a wonderful, wonderful medicine, which is used in Siddha system of medicine, which is used in long-term diseases like kapha-related diseases. So these things improved. Also, herbal mask itself improved 2 or 3 points regarding that saturation. And we made the patient pacify during the period, because whenever a patient sees their oxygen level is around below 90, they used to get tensed. So we made them pacify, but giving the medicines, we could see after half an hour there is an increase in their oxygen level. So just we make them pacify, and if it improves, everything is okay. We treat with our Siddha system of medicine. If if it is not working or getting dropped, we just refer to the higher center.
Obviously, that is a good practice. We cannot experiment or treat at the
Yeah,
expense
yeah,
of the life. I would have very appreciated. So I'm very much curious to know more about the herbal mask because this is the first time we are listening to and understanding how effective it has been. So
yeah,
collected certain herbs and then how you prepared this? In fact,
yeah.
made this. Yeah.
Yes, sir. Actually, it was an idea given by our district collector. Why people should use ordinary masks? Why can't you change the mask into herbal preparation? So, a doctor who is a young practitioner was supporting me. His name is Dr. Bhaskar. He is come from a traditional Vaidya family. So he only
Okay.
devised the ideology, and he used volatile oils taken from example Karpuravalli, Vitex Negando, Nochi. So whichever plant which had volatile oil, he just extracted the oil, and he used to just spray the extract into the mask, and we can just apply. Similarly, we had menthol salt, and similarly these all things were mixed inside the extract, and he used to apply in the mask, and it is just applied. So
So
there is
this
no
mask
synthetic
is
things.
for 24 hours, or some part of of 10 hours or 24 hours. And next day you need to give them the different mask because it's a spray. So this
Yeah,
element may get evaporated.
yeah, sure, sir. It will be there for around half an hour to 1 hour only. Normal mask we
Oh,
are applying. Yeah, after that we have to change another mask. So for a day, one herbal mask is enough. So next day, for
that's
next 5 days, we'll be giving you herbal mask since it
so
gets
great.
evaporated very.
I would request you to also publish a paper on this use efficacy of the herbal mask. You have data
Sure,
or something, the post data collection can also be possible because the
sure, sir.
patients, oh, that will give a new light to the cure of COVID-19 patients here in northern
Sure.
India, across India also. So I would
Yes,
want you to appear
definitely.
as the pioneer. Yeah, obviously the Tamil Nadu as a state, the collector, district collector as the leader, so many pioneers did this pioneering job. So thank you. Do we have some questions from the audience side also, Aman? Or Dr. Amit, you would like to ask certain questions? I'm through with the questions. Or you got all, there were presentations, so you all got answered. Everything is answered to your best satisfaction level. I think everything is answered. But anyway, so okay, Dr. Vikram. So how when you are planning to come over Delhi? Any recent visit on your cards?
Yes. Yes, sir. When the COVID gets over, surely I would like to visit them because I'm a travel enthusiast who believes in, who like birding and traveling. Surely I will contact you when I come out. Sure, sir.
Yes,
Thank
please.
you for the
We would like to meet you and Dr. Arvind Dhanush. You come together. Let us have. Then the situation, becomes good here. We would like to have a physical conference.
sure, sir.
Not the
Sure.
online one. In that, it will cater more value. This is how I think.
Yeah.
So we would await your arrival, Dr. Arvind Dhanush's arrival, and I repeat again that we would like to promote the Siddha medicine in northern India, not only for the COVID patients or the treatment of the COVID, but in the entirety, wherever it is applicable best, it should be help people here and everywhere. Thank you. Thanks for your time. It's 2 hours. Normally, our shows take 2 hours time. I have not seen anything going before at least 100 minutes. So we have again 2 hours taken from you and Dr. Arvind. So many thanks and namaskar.
Thank you.
So
Thank
I
you, sir.
I would contact you once again and we'll see you again. Thank you.
Thank you,
Thank
sir.
you, Dr.
Thank you.
Arvind,
Thank you,
and
sir. Thank you
thank you,
very much,
Dr.
sir. Thank you. Bye.
Thank you.